Did you know that some routine health checkups, especially after age 70, might actually make you feel more anxious, more tired, and even weaker? Hi there, friends. If you're over 70 or you care for someone who is, this message is especially for you. Most of us grew up believing this. The more checkups you do, the better your health will be. The more tests you run, the earlier you catch diseases. That makes sense, right? But here's the truth. After age 70, your body is no longer operating like it did at 50, and not all tests are still helpful. In fact, some of them may cause unnecessary stress, costly follow-ups, and medical procedures you don't actually need. Today, I want to gently challenge that idea and show you a smarter, more peaceful way to care for your health after 70.1. The real goal after 70 isn't to catch everything you see. The goal after 70 isn't to scan for every possible disease. Instead, it's to understand what's really going on inside your body, what matters, what doesn't, tend to focus on peace of mind and stability, not chasing every little number. A lot of people go in for full-body checkups thinking, the more they look, the safer I'll be. They get blood work, endoscopies, CT scans, stress tests, you name it, but doctors and medical experts, even the American Geriatrics Society, agree that more testing does not always equal better health for older adults. 2. Why more testing can backfire. There are 3 big reasons why over-testing can actually be harmful at this age. First, your body is going through natural aging. Things slow down, including your liver, kidneys, hormones, digestion. So many normal lab values start to look a little off. But that doesn't always mean you're sick. If those results are judged using standards for people in their 30s or 40s, they might flag you as high risk when you're not. That leads to a chain of extra appointments, prescriptions, even minor surgeries that may do more harm than good. Second, some tests are invasive or require substances your aging body might not tolerate well. Things like colonoscopies, CT scans with contrast dye, or full sedation can carry side effects: low blood pressure, dizziness, nausea, kidney stress, even temporary confusion after anesthesia. These effects may seem small to a younger person, but in someone over 70 they can snowball into bigger problems like dehydration, falls, or long-term fatigue. Third, even finding small, harmless issues can create big emotional burdens. Let's say they find a tiny benign cyst or nodule that's not causing any symptoms. Now you're worried. You start losing sleep, going in for more biopsies, more scans just in case. But that extra testing doesn't change your quality of life. It just adds stress. 3. The new approach, less is more for seniors. That's why more and more experts today are shifting away from the old idea that deeper testing is always better. Instead, the focus is on goal-based screening-only testing when there's a clear reason, watching for real warning signs, and letting the rest go out after 70. Your healthcare should feel like a well-maintained old car. You don't need to replace the engine every time a new noise appears. You just need to keep the oil clean, check your brakes, and treat it gently. You don't want to tear apart a perfectly running car just because it's getting older. Same goes for your body. 4. One example, colonoscopies after 70. Let's take a look at a real-life example: routine colonoscopies. Colonoscopies are an important screening tool for colorectal cancer, especially for people over 50. That's absolutely true for middle-aged adults. But by the time you reach 70 or 75, if you have no symptoms, no stomach pain, unexplained weight loss, blood in your stool, or changes in your digestion, then a colonoscopy may no longer be necessary. Why? Because the prep process is rough on older bodies. It requires light anesthesia, which can cause temporary confusion or dizziness. There's a higher risk of complications like perforation or bleeding during the procedure. And most importantly, colon cancer grows very slowly. If you've made it to 70 without risk factors like family history or polyps, the chance of a new dangerous cancer showing up is low. In fact, the American Cancer Society now recommends skipping routine colonoscopies after age 75, unless you have specific symptoms or a high-risk background. So if you're eating well, digesting normally, and feeling fine, there's no need to go looking for trouble. Focus instead on eating leafy greens, drinking plenty of water, walking regularly, and yes, checking your stool patterns daily. That's often enough to keep your colon healthy in a sustainable way. Another common test that sounds high-tech and reassuring but often ends up doing more harm than good is the full-body CT scan or full-body MRI. These are often marketed as total health checkups, especially to older adults. The idea is that if you scan everything, you'll find every hidden problem early. But here's the thing. That's not how these scans work, especially not for people over 70.1. Full-body scans, expensive, unnecessary, and sometimes harmful. These scans are often sold as part of premium wellness packages advertised with shiny machines and promises like, "Get peace of mind with our full-body cancer check." But here's the reality. CT scans expose your body to high doses of radiation. Do 1 or 2, probably fine. But if you're getting them regularly without reason, that radiation adds up and can actually increase long-term health risks, including bone marrow stress or kidney strain. Mr. While safer in terms of radiation, they use magnetic fields. Not X-rays are expensive, take a long time, and often turn up harmless findings, teeny cysts or nodules that don't need any treatment. Let's say your CT finds a small 1 cm cyst in your liver. No symptoms, no danger. But now you're anxious. The doctor says, let's biopsy it to be safe. Suddenly you're getting blood work, sedation, maybe even a needle biopsy or for something that may have never caused a single problem in your life. And worst of all, nothing you found changed your health outcome. But the anxiety, the costs, and the side effects, they're real. 2. More imaging can lead to more interventions. This is what we call the cascade effect. You start with one test, and suddenly you're on a medical treadmill you didn't ask for. That benign spot in your thyroid, that tiny nodule in your lung. It might have sat quietly for decades without harming you. But now you're getting monthly scans, maybe even surgery, for something that was never a threat. Don't get me wrong, imaging can save lives when used correctly, but full-body scans without symptoms, especially for people over 70, often cause more confusion than clarity. That's why the best doctors today recommend only scan what needs scanning. Don't scan for curiosity. Scan when something doesn't feel right or when your doctor has a real clinical reason. 3. Another one. Cardiac stress tests. When are they worth it? Now let's talk about another big one, the cardiac stress test. This is where you walk on a treadmill while your heart is monitored to see how it responds to exertion. It's designed to detect signs of restricted blood flow, angina, or early heart disease. Sounds smart, right? But again, if you're over 70 and have no chest pain, no shortness of breath, and no trouble walking or climbing stairs, do you really need this test? Probably not. Here's why. Older adults may not be able to complete the full treadmill test. Fatigue, balance issues, or arthritis can interfere, leading to inconclusive or misleading results. The test might suggest a possible abnormality, even when there's no true heart disease. That sends you down a rabbit hole of more tests, angiograms, stents, medications when none were actually needed, and the physical exertion of the test itself can sometimes cause falls, dizziness, or drops in blood pressure, especially if you haven't been very active lately. So, what's the better approach? Only get a cardiac stress test if you're having real consistent symptoms, chest discomfort, shortness of breath when walking, unexplained fatigue, or sudden drops in energy. If your heart feels fine and your daily activity level hasn't changed, then your body is already passing the test every day for what to do instead. Watch the right signs. Here's something I always remind my older patients. Your body is always talking to you. Listen to what it's saying, not just what the machines are looking for. Instead of running tests just to be safe, pay attention to real-life signals. Are you more out of breath than usual? Are you waking up at night gasping? Have you lost weight unexpectedly? Are your legs or ankles swelling? Do you feel new tightness in your chest when walking? These are the signs that do matter. And if you notice them, that's when tests become helpful, not harmful. Asterisk. So far, we've talked about how certain tests like full-body scans or cardiac stress tests can create unnecessary fear and even health risks if used when there are no real symptoms. But there's one more group of tests I see a lot of older folks doing on autopilot, every 6 or 12 months, without ever asking, do I really need this again? I'm talking about routine heart imaging. This includes things like coronary angiograms, heart artery scans, echocardiograms, ultrasound of the heart, electrocardiograms, EKGs or ECGs. Many seniors go for these tests like clockwork, even if they feel perfectly fine just because they signed up for a checkup package or were told it's best to be thorough. But let me ask you this. If your car is running perfectly, would you take the engine apart every few months just to check? Probably not. Point 1. When heart imaging isn't helping, let's say you go in for a routine heart scan. You've had no chest pain, you walk every day. You don't get winded climbing stairs. Your blood pressure is stable. The scan shows a bit of plaque, some mild narrowing in an artery. Nothing dangerous, nothing requiring surgery. But what happens next? You get scared. The doctor says you've got early-stage atherosclerosis. Suddenly you're on for new medications, cutting out foods you love, avoiding activity, and checking your pulse every 15 minutes. You've gone from healthy and happy to stressed and worried. And worst of all, that plaque was probably there 5 years ago and will still be there 5 years from now without ever causing a problem. In many cases, we find things that don't need fixing, but we fix them anyway. That's not prevention. That's overtreatment. 2. Real risks of over-imaging. Might think, what's the harm in looking? Well, even just looking can carry risk. Angiograms often involve contrast dye, which can strain the kidneys, especially in older adults. They also require inserting a catheter, which means a risk, even if small, of bleeding, infection, or damage to blood vessels, particularly in people with fragile or narrow arteries. Echocardiograms and ECGs are generally safer, but even these, when done too often without cause, can lead to false positives, abnormal readings that don't reflect your real health status. That can push you into a cycle of more advanced and riskier procedures. 3. Don't let a scan steal your peace. I remember one patient, Mr. Alvarez. He was 73, played golf twice a week, no symptoms at all. 1 year, he did a heart scan as part of a wellness package. They found mild narrowing and recommended follow-ups every 6 months. Over the next year, he went through 3 angiograms, added 2 medications, and gave up coffee, red meat, and his weekly poker game because he thought he was on the edge of a heart attack. But nothing ever happened. His arteries never got worse. His quality of life, it went downhill not because of illness, but because of fear. So please don't let a test make you sicker in your mind than you are in your body. Point 4. What heart tests should look like after 70 now. Don't get me wrong, heart testing can save lives when used wisely. So when is it appropriate? Here's what I recommend. Do a heart scan or ECG if you have symptoms like new or worsening chest pain, shortness of breath on exertion, lightheadedness or dizziness, irregular heartbeats, swelling in the legs or feet. Get imaging if your doctor notices an abnormality during a checkup like a murmur or irregular rhythm. Follow up if you have a history of heart attack or significant heart disease. But if you're walking, sleeping, breathing, and living normally without signs of cardiovascular stress, then routine scans probably won't help you feel better or live longer. 5. Use daily life as your real test. Honestly, one of the best tests we have. Your daily activity if you can. Take a walk without stopping, climb stairs without pressure in your chest, sleep through the night without gasping, laugh, eat and move around without fatigue. Then chances are your heart is doing just fine. We don't always need machines to tell us what our bodies are already saying loud and clear. Let's shift to something that's become more and more common. Thanks to today's advanced imaging technology, finding things that don't need to be found these days. With just a quick ultrasound or CT scan, doctors can detect tiny nodules, cysts, or spots in your liver, thyroid, kidneys, or lungs. Even if you feel perfectly fine at first glance, that sounds great, right? Catch things early. But here's what most people don't realize. Most of these small findings are harmless. In fact, many people walk around with tiny nodules their whole lives, and they never cause a single symptom or health issue. 1. When finding something isn't a good thing. Here's a story I'll never forget. A patient named Mrs. Thompson, 72 years old, went in for a general wellness scan. She had no complaints. She ate well, walked every morning, and slept just fine. Her CT scan picked up a tiny 0.8 centimeters calcification on her thyroid, completely asymptomatic, and probably there for years. But once it was discovered, everything changed. She was referred for a biopsy, which turned out inconclusive. That led to another scan, then a follow-up biopsy, and eventually her doctors recommended surgery just to be safe. She ended up having part of her thyroid removed. Her recovery wasn't easy. Fatigue, voice changes, medication side effects, and all of this for a nodule that would likely have never affected her life. Worse still, she told me she spent an entire year worrying about cancer that never came. That's what overscreening can do. To the mental burden is real. We often focus on the physical risks of medical testing, infection, anesthesia reactions, but we don't talk enough about the emotional damage of finding something you didn't need to know about. These tiny findings, often labeled indeterminate or monitor for changes, can create a constant, low-grade anxiety that steals joy from daily life. Suddenly, Googling medical terms, waiting for follow-up appointments, and constantly checking for symptoms that didn't even exist before. And for what? If the discovery doesn't change your outcome, but does change your peace of mind, was it really worth it? 3. Biopsies and surgeries aren't always minor now. Let's talk about the risks of acting on these findings. Biopsies aren't always simple. Even a small needle biopsy can cause bleeding or bruising, pain or swelling at the site, temporary confusion or weakness, especially in older adults. And surgeries, even minor ones, can lead to extended hospital stays and confusion known as post-op delirium, infections, or scarring, loss of function, especially when organs like the thyroid or kidney are involved for people in their 70s or 80s. Even a small medical setback can mean a longer recovery and greater impact on quality of life. So before you jump into treatment for a tiny silent finding, ask this: will fixing this help me live better or just make me more anxious? For what the experts say, the medical community is catching on. Trusted organizations like Choosing Wisely, the American Geriatric Society, and the U.S. Preventive Services Task Force now recommend against routine screenings or treatments for certain low-risk findings, especially in older adults with no symptoms. They suggest a smarter, gentler approach called watchful waiting or active surveillance. In other words, if a spot isn't growing, hurting, or changing your life, leave it alone. And here's the key: not acting doesn't mean you're ignoring your health. It means you're protecting it by not exposing your body and mind to stress it doesn't need. 5. Ask the right questions. Before every test, if you're ever offered a scan or biopsy, just to be sure, here are 3 questions I always recommend asking your doctor. What will we do with the results? If the answer is probably nothing, maybe you don't need the test. What are the risks of this procedure? Always consider the physical and emotional toll. Is this likely to change my care or improve how I feel? If it won't, maybe your time and energy are better spent elsewhere, like on sleep, food, fresh air, or movement. So what does smart, empowered healthcare actually look like after 70? Looks a lot less like a checklist of annual tests and a lot more like tuning into your real, lived experience. Because the goal after 70 isn't to uncover every possible issue. The goal is to stay functional, peaceful, and engaged in your life. Point 1. Your body isn't a machine that needs constant diagnosis. Let's break that old mindset. If I don't check everything, I'll miss something. That way of thinking worked when we were in our 40s or 50s, when early detection could mean decades of prevention. But after 70, the picture changes at this stage. Your body's physiology has naturally shifted, organs slowed down, lab values may drift slightly outside the normal range for younger people, but that doesn't always mean something's wrong. Trying to fix those numbers often leads to over-intervention. You may start treating numbers instead of treating yourself. Instead of asking, what tests should I get? Try asking, how do I feel? Move, eat, sleep, and connect. That's where the real health answers live too. Think of your body like a classic car. Imagine you own a well-loved vintage car. It's not brand new. It's not meant to be pushed to the limit. But when cared for properly, it still runs beautifully. Would you rip out the engine every year to inspect it? No, you'd keep the oil clean, drive gently, monitor for odd noises, and enjoy the ride. Your body is the same. After 70, it needs targeted care, not endless diagnostics. That means staying active in ways that feel good, eating nourishing, easy to digest foods, managing stress gently, getting sleep that actually restores, staying socially connected and mentally curious. These are the true prescriptions for longevity and joy. 3. When to say yes to testing now. Let's be clear. We're not saying never get tested. There are times when tests absolutely matter, especially if there are real signs something's wrong. Here's when you should check in with your doctor. Sudden weight loss, blood in your stool or urine, chest pain with exertion, new swelling in your legs or face, changes in memory, mood, or coordination, difficulty sleeping due to shortness of breath. When symptoms show up, they guide us to the right tests. That's what medicine is meant for, not to chase invisible shadows, but to solve problems when they arise. 4. So what should you not do? Let's quickly recap the 5 types of tests you should think twice about if you're over 70 and not experiencing symptoms. Routine colonoscopies. Unless you have symptoms, the risks often outweigh the benefits. Full-body CT or MRI scans. These can lead to false alarms, unnecessary biopsies, and extra radiation or cost. Cardiac stress tests. Without symptoms, they can create misleading results and risks during testing. Repeated heart imaging like angiograms or echocardiograms. These are rarely helpful without a real change in symptoms. Biopsies or surgeries for tiny, harmless nodules, often done out of fear. They can cause more harm than good. If your doctor recommends one of these, ask, is this really necessary for how I feel right now? If the answer is no, you might be better off skipping it. 5. What you can do instead of chasing perfect health. How about we focus on living well? Here's what works better than almost any test: a 10-minute walk outside, a warm home-cooked meal shared with someone you love, a glass of water when you wake up, a nap when you're tired, a conversation with a neighbor or old friend, a moment of silence to breathe deeply, a laugh over something silly, a good night's sleep without worry. These moments are healing. These moments protect your brain, your heart, your spirit. In fact, sometimes they heal you more than any prescription ever could. 6. Final thoughts. Less testing doesn't mean less care. You might still be wondering, if I don't test everything, what if I miss something? That's a fair concern. But here's the truth. Choosing fewer tests doesn't mean giving up on your health. It means living smarter based on science, experience, and the wisdom of aging. The best care for older adults today is shifting toward minimal but meaningful testing, active listening to symptoms, supporting the whole person, not just numbers on a lab report. Your peace of mind, energy, and independence matter more than a long list of test results. So be smart, be selective, and trust that your body after 7 decades of life has wisdom. 2. If this video helped you rethink how you approach health after 70, I'd love it if you gave it a thumbs up and hit subscribe. More importantly, share this with someone you love, especially a parent or friend who's been getting test after test out of fear. Let's help each other live longer, not through constant worry, but through calm, conscious choices. Thanks for being here. Be well, be kind to your body, and I'll see you in the next video.